So how have the health risks changed for the HIV population, and why are HIV patients at a higher risk for cardiovascular disease? So let's take a look at the positive changes for HIV patients over the last several years. The good news is that our HIV population is living longer and healthier. We have patients who were diagnosed with HIV many years ago, and with HIV therapy and continual attention to better health, they have been able to keep HIV well controlled and enjoy their lives. I'd like to show you a comparison here. As you can see, when the HIV is not treated, the chances of succumbing to AIDS-related death is significant and ultimately inevitable. But as our therapies and tests have evolved, more and more HIV patients are dodging the AIDS-related health problems and deaths altogether. Yes, this is great news. However, some patients have told themselves, HIV is not so bad after all. What was all the hype? Here I am, 25 years post-diagnosis, and I'm fine. Well, yes, good for you. With your HIV under control, you are doing well. But there are some important factors to understand that may remain symptomless until they have done significant damage to your body. Even with your HIV under control, you are more likely than an HIV-negative individual to have increased cardiovascular risk. That's why HIV in your heart is here to help. So, if you want the best quality of life, you also need to pay attention to your cardiovascular wellness. Everyone needs to pay attention to this, but HIV-positive individuals have even more incentive to pursue heart-healthy living. HIV affects your entire cardiovascular system for many reasons. One, you are more likely to have an increase in lipids that can collect on your artery walls throughout your cardiovascular system. Chronic inflammation may cause the plaque buildups to more easily develop into inflamed pockets of plaque, leading to rupture and blood clot. You are at increased risk for diabetes, which also has implications for your entire cardiovascular system. Smoking in particular presents a greater risk of harm for you, both from a cardiovascular standpoint and an increased risk of various cancers and emphysema. High blood pressure presents a potentially greater risk for you than for someone who is HIV negative. But again, we have good news for you. There are medications and specific things you can do to get your cardiovascular health in the best shape possible. Your efforts to improve your own wellness will pay off for you, and we're here to support you as you make each change one step at a time.